So, good morning, everyone. I'm Dr. Aruna Saradha, Consultant Reproductive Medicine, Veshti Fertility Center, Domasandra. So, today we'll be talking about the causes of female infertility. So, as we all know, infertility can be uh, contributed by any of the partners. The cause can be either in the female partner or in the male partner, sometimes even in both of them. So when we see female infertility, that is the causes in a female which contributes to infertility, it contributes to about 1/3 of the cases. So before going into that, just I want to brief about the common factors which are involved in normal conception. So this is a normal female reproductive tract. So many of you might be about this. What are the organs which is in the pelvis, which is essential for female reproduction. So this is the uterus. You can see this is the cervix. This is a uterus, and on either side of the uterus you'll be having the fallopian tubes. These structures are the fallopian tube, and the white structure which is just in front of it are the ovaries. So normally for pregnancy to happen, so in a month, in a woman who is having regular periods, at least one ovum normally will be released, or the one egg will be released from this ovaries, which will be taken up by these fallopian tubes. So the ovary which releases the egg, and this structures which are the fallopian tubes, they will be having the fimbria at their ends. So they will pick up the ovum, and this ovum will get transported in this tube. So during this time, when there is an intercourse, the sperms will be deposited in this cervix. So they will swim up through the cavity, and they will come through the tubes, and they will mate with the egg which is already in the tube. So this will result in the formation of embryo. So this embryo will travel back again this way until it will come inside the uterus, and it will get implanted into the endometrium, or the lining of the uterus. So and it develops into a baby. So this is how the normal fertilization and pregnancy happens. So looking into the female infertility, so having seen that what are the things which are involved in fertilization and achieving a pregnancy, any of the problems which is affecting anywhere in this pathway can contribute to the infertility. So first we see anovulation, that is, first we saw the egg will be released from this ovary, right? So if any factor which is preventing this normal egg release is inherent, then it may contribute to infertility. So the normal egg release will be affected. So what are the factors which contributes to this anovulation, or the problems associated with the egg being not released? So the egg release also depends on the factors from the central nervous system, that is brain related factors, because the brain has structures like hypothalamus and pituitary which produces hormones. So hypothalamus released hormones will control the pituitary, and pituitary will produce two hormones, that is FSH and LH. This FSH and LH will act on the ovaries, and this is responsible for the normal egg development and release. So any factor which can affect the hypothalamus and pituitary, so it can be various factors like stress related factors and weight gain, excessive weight loss, abnormal exercise patterns, or any chronic medical conditions, or any lesions in the central nervous system which requires treatment like surgeries or radiations. So various factors which causes any insult to the hypothalamus and pituitary, which control the function of the ovary and the egg release, will contribute to this abnormal ovulation. So these women often they will have amenorrhea, that is, they will not have periods for many months altogether, or they will have an irregular pattern of menses and ovulation, that is, no release of ovary or the egg, and contributing therefore to this, since there is no egg and there is no egg available for fertilization, these women eventually will go up into infertility. So next cause which affects the ovulation is the PCOS. Many of you might be knowing this is a polycystic ovarian syndrome. So where the egg release from the ovary is affected, so these women often they will be having obesity associated with the insulin resistance, and there is anovulation, that is no lack of release of ovum from the ovary because of hormonal abnormalities, and this also contributes to irregular pattern of periods and infertility. Next factor which is associated with the release of egg from the ovary, which is contributing to infertility, is the premature ovarian failure. So normally ovarian failure or the menopause is commonly expected around like average age of about 50 years. So if you see the menopause which is less than 40 years, in such cases it's called premature ovarian failure, where the egg content in both the ovaries will be less than expected for the normal age, which is called as a primary ovarian insufficiency or the premature ovarian failure, which is defined when this happens below the age of 40 years. So these women will be having less count of the follicles and the ovum within it compared to the women of the similar age. So this contributes because of the less number of eggs or the reserve in both the ovaries. These women are prone for having infertility. So what are the factors? It can be because of genetic parameters. So their genetic composition is itself in that they having only less number of reserve or the ovum in the ovary, or it can be due to any infections which can affect the ovaries, autoimmune conditions where the autoantibodies are present, that is the antibody which destroys the body's own cells. Sometimes if autoantibodies are present against the ovary, it also can be a causative factor. Sometimes extensive surgeries involving ovaries, for example like for surgery for endometrioma, it is a condition which can affect the ovaries. So when we do surgery to cure it from the ovary, we may have to necessitate sometimes extensive portion of the normal ovary will be destroyed. In such cases, the follicles which is a normal ovarian reserve which is present also will get depleted. Also sometimes any chemotherapy, radiations, all these factors will affect the ovarian reserve. Sometimes it is an unknown factor, we may not know what is the exact reason, but many of the women less than 40 years, they will be having very low reserve, which is a premature ovarian failure. So these are the factors which is responsible for infertility from the ovarian aspect of view, that is the anovulation side of view. Coming next is the tubes, which are very important for fertilization because they transport the egg and the embryo later. So any factor which affects the tube, which can be either congenital, developmental abnormality, by birth itself they have any problem in the tubes, and the second is most commonly it can be due to any infections. So sexually transmitted infections like gonococcal chlamydial infection. So what happens is most of them have infections which is sexually transmitted. So these infections from the vagina and cervix, they will be having impact on the uterus and tubes and ovaries also. So they spread this way and they cause severe damage to the uterus, that is the endometrium lining, and they cause endometritis, that is the infection of the interior part of the uterus, which also contributes to infertility. And they spread to the tubes, so they damage the tube, the normal pattern of the tube. The tubes get altered in their anatomical pattern, how they are, and the function of the tube will be disturbed. There will be small hair-like structures which are present inside the tube, which is called as a cilia. These cilia are responsible for moving this gametes, that is the egg or the embryo, towards the uterus. So these infections, what they do is they destroy all these cilia, so the normal function of the tubes will be disturbed. So this will contribute to infertility. Or sometimes what happens is, because this function is altered, because the cilia and all is damaged, so the internal architecture of the tube is damaged, sometimes a fertilization happens, that is a sperm and the ova mate and the embryo is formed, but since the function of the tube is compromised, it is not able to transport the embryo towards the uterus, so the embryo gets stuck in the tube itself. So what happens is it develops in the tube, and this is called as an ectopic pregnancy. So this has an important consequences. What happens, sometimes it cannot survive or grow to beyond extent because it cannot grow in the tube. So sometimes it contributes to rupture of the tube, and it is very dangerous for the mother also. So this is the second thing. Third thing is the tube can be damaged because of any previous surgeries or extensive pelvic surgeries, which can contribute to adhesions, that is the tubes, ovary get stuck with each other, so the normal function of the tubes and ovaries will be compromised. Sometimes women after having children, they go for tubectomy. So they do a tubectomy, that is sterilization, where the tubes will be cut off. Later, due to any reason, if they want once more a child, then you have to look into this factor because the tubes are already cut off. So either the option would be we have to go for a repair of the tubes. So repair of the tubes can be done, but we cannot guarantee 100% success rate that the repaired tube will eventually lead to a good pregnancy. or it can also contribute the same thing, ectopic pregnancy, because we have repaired already a damaged tube. So it can also lead to ectopic pregnancy. And also there can be or the other option is you can go for IVF. So this is the second factor which is contributing infertility, that is the tubes. Coming to next is important thing is the uterus. This is a uterus configuration, and if any factor which alters the normal configuration of the uterus, it can contribute to infertility. So first is congenital anomalies, that is, this is a normal structure of the uterus. So by birth, if you have any altered thing, altered configuration or architecture of the uterus, it can contribute to infertility. Commonly you can have many different types of abnormalities are present. So it can be like a biconjugate uterus, where you have this uterus has two parts. The cervix is one, but here you have two compartments. Or it can be a diadelphus, where you have complete two uterus, because at when the uterus develops, it develops as a two organs, and later it gets joined as a single. So sometimes what happens in some women, this joining is at fault. So they both will not join, so they are present as a two different structures. Sometimes what happens, they join together, but the center part after joining, it has to get resolved or it has to get absorbed. That doesn't happen. So there will be a partition in the center of the uterus. So this is called as a septate uterus. So unicornuate uterus, where you have there is development of only single half of the uterus. So most of the times the abnormalities of the uterus, actually they will not contribute to infertility as such, but many of these women will conceive, but they will have problems like abortions because of the abnormal configuration of the uterus, or they can have some problems during pregnancy, like premature delivery, that is delivery before 9 months, like 7 months, 8 months, or they can have abnormal presentation, like the baby's presentation will be altered. So these are the factors which can happen. But mostly when we evaluate any female for infertility, the common abnormality which we come across most of the times is a septate uterus. That is, the uterus, as I told, it will develop a two structure. It will get fused to a single organ, and the center line, after fusing, it has to get resolved. But in this woman, the line will be persisting. So there will be a one partition in the center line. So this half will be present here, this side, and one half will be present on this side of the line. That is a septum. So this can be associated with infertility, because sometimes after the embryo is formed, it has to come and implant in the uterus. That is what we saw. So this, if it gets implanted on this line, so normally it has to implant on this endometrium, which is favorable, which is essential for the embryo to grow and develop into a proper baby. But if it gets implanted over the septum, then the septum configuration, that is the septums, what is present in this inside the septum, the formation, the septum, the components which are present in the septum will be different from that which is present in a normal endometrium, which causes the embryo to grow. So if it gets implanted on the septum, it will not be very favorable for the embryo to grow and develop, because of its componental architecture, which is different from the endometrium, and also the abnormal vascularity. So blood flow and all will not be similar to that of a normal lining of the uterus. So this will contribute to infertility. So depending on the other associative factors, we may have to remove the septum. And also other factors which is present inside the uterus, like if you can see, this is these are the fibroids, polyps. So fibroids, polyps means fibroids are which are the growth which is present inside the uterus. So this fibroids can be present anywhere in the uterus. It can be present in this fundus part, or in the middle part, or lower part, anywhere. So mostly these women can have pain, excessive bleeding. Apart from that, the size of the fibroids and where they are present will contribute to infertility as such. So suppose there are three types of fibroids. One is a submucosal, which we say they will be present in this cavity. The cavity means it's the main portion inside the uterus, is the endometrium part, where which is necessary for the implantation and the pregnancy to happen. If it is present here, then it is necessary that we have to consider it for a removal. Second are the intramural fibroids, which are present here, that is the muscular portion of the uterus. They can vary from very small size or to larger sizes. So depending on the location and the size, if it is intramural, which is larger in size, at least about a size of more than 4 cm, then we have to consider it for removal. There are also other fibroids which are present in the outer part of the uterus, this side, that is called as the subserosal fibroids. So these fibroids are not associated with the infertility, because they are completely away from the center part or the endometrium part, which is needed for pregnancy. These are present outside here, so we need not consider it for removal. So fibroids plays an important role because these fibroids will cause abnormal contractions in the uterus. They alter the blood vascularity of the uterus, and then sometimes, if they are present in this portion, lower part, they prevent the transport of the sperms, which have to come like this, in this way. Or sometimes they will present close to this cornua, that is the junction of the tube and the uterus. So here, if they are present here, this also affect the transport of the embryos to the uterus. So depending on the location, they contribute to infertility in different ways. So the size, the location, and other associated factors for infertility has to be considered, and based on that, management has to be done. Then polyps. Polyps are small tissues, pieces like growths which are present in the uterus. These also affect the normal implantation to occur and contribute to infertility, because they also act as some outgrowths in the uterus, thereby preventing implantation, and they cause some inflammatory changes within the uterus and affect certain expression of markers, because normally when the embryo comes and sits in the uterus will express certain markers. So these markers or the projections is essential for the embryo to go inside and get buried into it, and then to form a successful pregnancy. So in the presence of a polyp, these changes all will be affected. So this might cause to infertility, and we may have to remove the polyp, and we have to evaluate other factors also, whether they are contributing infertility. But if you see, especially there are no other factors, and if you see a big polyp, when you are following up on scans, it doesn't get resolved, then you have to consider it for removal. Then what are other factors which contribute to infertility from the uterus point of view is infections, especially the chronic infections. We have seen genital transmitted infections will come in, transmitted through the cervix and vagina, which affects the tube as well as the uterus and the endometrium. So they damage the endometrium. So the endometrium will be affected, leading to endometritis. So the normal function of this lining will get damaged. All these linings will get completely damaged, and the blood supply of the uterus will be affected. So this affects the implantation of the embryo. So pregnancy happening will be affected. Especially commonly it's the tuberculosis. So as I told, the infections can affect both the tubes and the uterus. So the tubes can be affected by the endometriosis, also the tubes can be affected by the tuberculosis, genital tuberculosis, also the uterus can be affected. So the uterus will be damaged by the tuberculosis, and also gonococcal chlamydial infections. So this extensive damage will also cause extensive adhesions, that is, this lining will get attached to one another, which is not favorable for implantation. So all these factors will lead to infertility. Then coming to cervix, this is a lower portion which is essential for transport of the sperms. So this structure also can contribute to infertility, because there can be some congenital developmental abnormalities in the cervix. So that can be there, and or it can be any polyps or fibroids which is present in the cervix, which affects the transport of the sperms. Or if you are doing any DNCs or excessive curettage, then it can cause excessive scratching of the cervix. This also can damage, and also uterus also. If you are doing any DNC vigorously, it can cause adhesions within the cavity of the uterus. So this extensive adhesions is not favorable for implantation and pregnancy to happen. So all these factors are essential for cervix and uterus. Then coming to other factors which can contribute to the infertility is the peritoneal aspects, that is the structures. And one more factor which is essential from the uterus point of view is the adenomyosis. Adenomyosis is what? This is a muscular layer of the uterus. This is the endometrium. So this, what happens in adenomyosis is this endometrium, which is where the embryo comes in. These tissues will grow into this muscular layer. So some deposits will be present in this layer. So the uterus in such woman will be bulkier. They will be having menorrhagia, chronic pelvic pain, and also contributing to infertility. So adenomyosis is also a cause for infertility. And coming to factors which are present outside the uterus, peritoneal factors, the most important thing is the endometriosis. Endometriosis means normally this is the endometrial lining which is present inside the uterus. In some women, these endometrial tissues are present even outside the uterus, that is in the pelvis. So what happens, this is various factors as to why it is present has been attributed. It can be a genetic factor, so it can be Sometimes because during periods when the endometrium gets shed and we have the bleeding, some of the tissues goes back like this to the through the tubes, and it gets deposited in the pelvis, and it comes out of the tubes and it get deposited in the pelvis, and later it itself starts to grow as a separate endometrial lining tissues. So these theories have been put forth. So what is the ultimate effect of it is, so when during every month when the endometrium lining grows, and suppose pregnancy doesn't happen, and when it starts shedding as in the form of menstrual bleeding, these tissues which are present outside the uterus also will experience the same thing. They also will grow and they also will shed. So these women will have severe pain during their periods, and also this endometriosis can affect the tubes, ovaries, and all these things can get stuck in the adhesions, because all these tissues will be present here and everything will get stuck in it. So the normal function of the tubes, ovaries, everything might be compromised, and also endometriosis which is present extensively in the pelvis can also affect the transport of the sperm ovum interaction which happens in the tubes. It affects the functions of the tubes, ovaries, and also it produces certain immunological changes, certain changes within the pelvis, like how if you have any infection the body reacts. So similar to that, there will be certain inflammatory changes which happens. So these all will affect together the fertilization and the implantation and the pregnancies. So depending on also in endometriosis, the endometrium, the receptivity, that is the, even though the embryo comes and sit here, the endometrium itself will experience certain changes which will not allow a proper implantation to occur. So in various causes can contribute to infertility in endometriosis. So depending on the age of the couple, the duration of married life, and then whether there are associated any other infertility factors which are present, and depending on the severity of endometriosis, it can be a grade 1 with very minimal, or it can be grade 2, it can be slightly more severe, grade 3 and grade 4. You have to consider the management according to all these factors. So as we have seen, the ovary, the tubes, the cervix, the uterus, and the peritoneal factors, all these factors will contribute to infertility. Excluding all these factors, there is one separate category which is the unexplained category. Unexplained is these women, obviously they will not be having any known factors. When you get tested, they will not have any problems related to the tubes. When you get the tubes test, the tubes will be completely open, and they will be having proper regular menses every month with normal release of ovaries, and they will be having no pathology in the uterus when you completely evaluate the uterus. So all the factors, abnormalities you can rule out, but still they will be having difficulty in conceiving. So it might be unexplained factors, so which is not very macroscopic, that is we are not able to visualize. It can be any problem like the receptivity problems, that is the endometrium is not having the proper receptivity to receive the embryo. So it might be due to certain cellular level changes which obviously we may not able to be experiencing, or it can be due to this woman can have normal egg which is coming out every month, but the quality might not be poor. Or when we get tested the tubes will be completely open without any block. That much we can test it, but there will be certain minute changes within the tubes which is essential to transport these gametes, like the cilia which I told, that is a hair-like structures which is essential to move the gametes. That may not be completely at a good level, which might be some pathology which is not obviously made out, can be contributing factors. Or sometimes what happens, the ovum will be released, the sperm comes, but the sperm and the ovum which have to mate, and then the embryo has to form, there might be some microscopic level abnormalities which is preventing this interaction of these gametes and fertilization to happen. So various factors can be contributing to this. This group comes under the unexplained infertility, where we are not able to properly establish the cause of the infertility. So after ruling out all causes, and if we have to be sure that it is unexplained, then we may have to consider treatment according to that group. So these are the common factors of female infertility. Thank you.